Technology today has led to great innovations in the genetic testing field, specifically prenatal testing. Prenatal testing is conducted on a developing fetus in order to detect any birth defects or genetic irregularities. Although it poses some risks, prenatal testing allows couples to know whether or not their child will be healthy, and if the child is not, grants them time to prepare medically, financially, and emotionally. Prenatal testing is often suggested to parents with a higher risk of an abnormal child, usually if a genetic disease runs in the family or the mother is over the age of 35. Prenatal testing solicits the debate whether parents should be given the right to possibly harm the unborn child, yet educating the patients before testing is key and allows the parents liberty to decide if it is right for them. The bill I will be following is the Prenatal Testing Program Education Bill, which calls for improved education for parents prior to testing. It would add on to the current education the information regarding environmental health, which would be made accessible to all parents looking to undergo testing. This education will promote healthier pregnancies and more educated decisions on prenatal testing. Prenatal tests were first introduced in the mid-1960s due to the discovery of the chromosomal mutation associated with Down syndrome. The mutation that causes Down syndrome is a trisomy in chromosome 21, which means that instead of the normal 2 copies of this chromosome, there is an extra copy which causes developmental issues in the child. Doctors and geneticists then realized they could study embryonic DNA by abstracting amniotic fluid from a pregnant woman. This procedure is known as amniocentesis. Early on, doctors would only conduct amniocentesis on women who were older than 35 because they were at a higher risk of a child with a chromosomal anomaly. This process can be used to test unborn babies for genetic diseases such as Down syndrome, Tay-Sachs disease, sickle cell disease, thalassemia, cystic fibrosis, neural tube defects, and a variety of chromosomal disorders. The discovery of this type of genetic test was the foundation for the establishment of several more genetic testing procedures founded in the past decade. This is a chart depicting the types of prenatal tests and the risk-benefits of each. This is a timeline that spans from preconception to post-pregnancy that identifies the times when certain prenatal tests and screenings would take place. Last April, a baby girl was born with the AIDS virus in Los Angeles, just a month after the first case was announced in Mississippi. The LA baby has been receiving treatment ever since she was 4 hours old, and her infection has seemingly been put into remission and possibly cured due to the very early and proactive treatment that she received. Now, almost a year later, the baby is still being treated and seems to be very healthy. The Mississippi baby, now 3.5 years old, stopped treatment after 18 months and seems to be free of the infection. The reason these 2 babies, especially the second, were so successful in their treatment was the proactive measures that doctors took very soon after the babies were born. These proactive treatments could have been further improved if the babies could have been tested for the virus before they were born. If doctors knew the situation before the baby was even born, they would have been even more prepared to treat the child and could begin treating the mother before the baby was born. The bill I'm following, requiring an educational program for the development, provision, and evaluation of genetic disease testing, should be passed because it provides parents with the background knowledge to make an informed decision about prenatal screening and testing. This bill requires the Department of Public Health to include prescribed information regarding the environmental health in the patient educational information and to post that information on the department's website, to send a notice to all distributors of the information to inform them of any changes and encourage obstetrician gynecologists and midwives to discuss the environmental health factors with their patients. This bill should be passed because it allows further things to be taken into consideration when deciding whether to undergo a prenatal test, which is a decision that should be well thought out and informed.